as necessary, as you've given evidence at several modules in this inquiry. Those following will, of course, know that you were Member of Parliament for West Suffolk between the 6th of May 2010 and the 30th of May 2024. Is that right?
That's right.
You were Secretary of State for Health and Social Care between the 9th of July 2018 up until the 26th of June, 2021.
That's right.
You've given evidence, as I say, on a number of occasions. In this module, as you know, we'll be focusing on the procurement and distribution of healthcare equipment and supplies. Mm-hmm. So may we start, please, with the stockpile?
Right.
We know from paragraph 36 of your statement that, in your own words, on coming into post as Health Minister, you were advised that the UK was a world leader in preparations for a pandemic.
That's right.
And we further know, perhaps we could have it pulled up onto the screen, from your book, The Pandemic Diaries, that's INQ 00059569777. The good news is, you say at the beginning of January 2020, good news is we've got 1 billion items of disposable personal protective equipment or PPE stockpiled and ready to dispatch to hospitals if required. It's stashed away at a secret location in the northwest where it's been gathering dust, hopefully not literally, since it was put together in 2009.
Yes, that's a description of what I was told at the time.
Yes, I was coming on to that. You were told that, were you not, Mr. Hancock, by, let's pull this up on the screen as well, INQ 000184105. It's page 2, internal paragraph 11. There are specific. The UK is acknowledged as being amongst the global leaders in preparing for a pandemic.
That's right. I'm not sure when this document's from, but that was the standard description given to me. And in fact, you'll recall, my lady, from Module 1, some time ago that we had that I had a day one brief in this area, and I then interrogated that brief, asked a series of questions, and we put in place some further actions as a result.
I was just coming on to that, Mr. Hancock. Did you have any reason to doubt what you were told here?
No, civil servants give their advice to the best of their knowledge in a high integrity manner in my long experience as a minister. It
was accepted, presumably, that any stockpile would eventually run out and a need to buy more in bulk would arise. Did you find any evidence of such a plan in place?
No, there wasn't a plan. I first ordered the opening of this stockpile and the ordering of more PPE in January 2020. So it was towards the end of January 2020. At the time, by recollection, this was when Professor Whitty was advising that a global pandemic was a 50-50 chance, and it was looking increasingly bleak in terms of a pandemic hitting our shores. And I think there were a handful, 2 or 3 cases in the UK. That was the point at which I began the process of ordering more PPE.
And more generally, your department was preparing for a potential outbreak of COVID-19 in the UK from as early as January 2020, wasn't it?
Yes. Sir Chris Wormwald moved to being full-time focusing on the potential pandemic in the middle of January. I can't remember the exact date. We went through this in Module 1, as I say. But yes, from very early on, we recognised the risk was very significant. And in relation to buying PPE, there wasn't a mechanism in place to buy more. And indeed, the purchasing of PPE was essentially decentralised, with the exception of SSCL, which I know has been discussed in this module. But remember, SSCL only existed to supply the 250 main hospitals, not the tens of thousands of other areas that came to need extra PPE.
I'm coming on to that in a few moments, so
Sure.
if we can park that, I promise I'll come back to it. I just want to continue on the line of questions that I've started with you. Did you ask officials at this stage, we're back in January 2020, when your department was preparing for a potential outbreak, COVID-19 in the UK, did you ask officials to assure you that the PIP stockpile was ready to deploy?
I don't recall if we had a deployment discussion specifically, but that was an inevitable part of using PPE, of course. And anyway, at that point, we had a distribution system to the hospitals in SSCL, which later fell over. So it was about early spotting that we'd need to buy more PPE and about opening up the existing stockpile for PPE. There was a third part, actually, which is important to note, which is that at the time, we'd been preparing for the potential of a no-deal EU exit at the end of January 2020. And the supply chain had built up some stocks, not specifically in PPE, but across the purchases that are relevant in this module. And the advice came to me towards the end of January 2020 to say we should tell industry to reduce those stockpiles. And given the risk of a potential pandemic, I overruled that advice and said we should not request the disbanding of these stockpiles once the risk of a no-deal Brexit had been taken off the table.
Were those EU exit stockpiles able to be to contribute positively to the need that arose due to the COVID pandemic?
Yes, very, very much, in two ways. One, directly, because there were more stockpiles in the supply chain than there would otherwise have been. The second is indirectly, and probably actually more important. It meant that brilliant officials like Steve Oldfield, who had worked on and led that policy, were then immediately able to turn the information about, in particular, the pharmaceutical supply chain, to understand that supply chain better. We just heard from Lord Bethell the lack of supply chain information in certain areas like diagnostics. But in terms of pharmaceutical drugs, and here the critical ones were anaesthetic drugs, although we didn't know it at the time, we knew those supply chains better than we ever had before because of the work preparing to, in case there was a no-deal Brexit. So there was information and actual goods, but it pertained less to PPE and more to things like medicines, as I say.
I asked the question because we heard yesterday from Lord Agnew, who gave his views on whether Brexit planning helped or hindered the task of procurement. I suppose you're offering an example of where it helped effectively.
Yes, it wasn't Brexit planning specifically. It was planning in case we'd ended up with a no-deal Brexit. Right. So, my view was that would not have been a good idea. I was against it, but it was still my responsibility to prepare in case it happened.
I've used the term Brexit planning to include the possibility of
in that case, yes,
a no Brexit, no deal Brexit. Let's just go back to your pandemic diaries, if we may. We go to the other end of the month, 30th of January. INQ 000569777 and page 2, and you say this: PHE's audit of PPE came back and did not lighten my mood. The paperwork is all over the place. There's no clear record of what's in the stockpile, and some kit is past its best before date. I've instructed officials to work out what we need fast and buy in huge quantities.
Yes.
Now, there's two questions that arise from that. I suppose the first is that you had said, I suppose rather jokingly or glibly, that you hoped that it hadn't been gathering dust.
Yeah.
In the event, it was effectively gathering dust. Much of it had expired, hadn't it?
Yes, I wouldn't say it was glib to say I hope it hadn't been gathering dust. It turned out that that metaphor was appropriate.
Well, you would perhaps say prescient in that case. But the second question I have for you in relation to this is, were you given any explanation as to why it was that some of the kit was past its best before date?
No.
No.
All I would say, the explanations I was given was that the record keeping had not been clear. I wasn't given the next explanation, which is why the record keeping hadn't been clear. To me, I come from a technology background. It's obvious that you need to keep a decent record of everything that you put into a stockpile. I mean, this wasn't the only problem. The bigger problem was that it wasn't pickable.
So adequacy of the stockpile is one issue, but sufficiency is another, and you deal with this in your paragraphs 43 and 44. When you say that both the EU exit stockpiles and the existing pit stockpile were not going to be sufficient, or were going to be insufficient to meet the demands of the pandemic,
Yeah.
what is it that you mean by sufficient? Are you talking there about volumes or items or types of items?
Well, all of those things. So you have to remember the context here. January 2020, we in the department could foresee the likely potential, which Professor Whitty put at 50-50, of a global pandemic. We could see, therefore, the immediate consequences. Once you took that risk seriously, and we did, you immediately see a whole series of consequences. And this period, in the last 10 days or so of January 2020, is when we put in place a whole series of actions to mitigate the gaps that immediately became evident. One, having been reassured that we had an adequate stockpile, which you can see in the middle of January and before the pandemic, by the 30th of January, when I asked for the audit comes back and there are serious problems. Two, we did not at that stage know the nature of the pathogen, but we knew that it was obviously very serious because it was looking 50-50 like a global pandemic. So at that point, I instructed that we got going on all the things we needed, including the fact that whatever the nature of the pathogen, we were going to need more PPE, because you can never stockpile enough PPE for a whole pandemic. I was told we had around 1 billion items. It was clear to me on some relatively rudimentary assumptions that if the pandemic was, I think at that point, on the assumption that there weren't mitigating factors, that it would last in 3 waves for about 15 weeks each wave. If you put everybody in the health system in PPE for that period, you're going to run through the 1 billion items. So we didn't know the scale of what need would be. We didn't know the nature of the pathogen. But we did know that if there's a 50-50 chance of a global pandemic coming, we need to get buying now. And we also could see that since we were making these decisions in the UK, others would be making these decisions around the world, and therefore there would be a massive crunch. So my instruction was to get going as quickly as possible.
I'm going to move on to that crunch in a moment. I just want to make sure I understand your evidence in relation to never being able to stockpile enough PPE for a pandemic. You mean given limited storage capacity?
Yes, in the realities of the world and in the realities of public finances, I was meaning that colloquially rather than literally. Of course, you literally could, but even with the experience of the pandemic, I'm not exactly sure how big the stockpile is right now. I know it's more pickable and it's spread around the country rather than all being in one big shed, and I hope, beyond hope, that they have an adequate IT system telling them what's actually in there and good records. But over the course of the pandemic, you need billions and billions of items of PPE. We could be far better prepared than we were last time. But at the same time, it's also clear to me that as soon as the next one veers onto the horizon with any reasonable chance of becoming as catastrophic as COVID-19, you need to get ordering PPE.
But let's just be careful not to mix issues, Mr. Hancock. Over the course of the pandemic, that's not a reference to the stockpile, is it? It's one thing to stockpile PPE, if we're focusing on PPE.
Sure.
So that in the event of a pandemic, there is a reserve.
Yes.
And there are various policy decisions that go into the extent to which you do that.
Yes.
Or instead, the extent to which you buy in an emergency.
And have domestic supply, yes.
And have domestic supply. That relates to the stockpile.
Yeah.
Buying during a pandemic is something quite different, isn't it?
Yes.
Yeah. So when you say you can never stockpile enough PPE for a pandemic, you're saying it colloquially. That very much depends on what policy decision is taken as to the appropriate or optimal size of and type of a stockpile.
Yes.
And whether you want to buy in the emergency.
Okay, if I was to put it technically rather than colloquially, what I mean by saying you can never buy enough is, whilst it would be literally possible to store 100 billion items across the country, in the practice of government, with restrained resources in peacetime, it would be extremely unlikely to get authorization to do that and to be able to. And so in practice, one's future policy, this isn't a description of then at all, future policy should be to have much higher quantities of much better organized PPE than last time, but nevertheless, the moment you can see a pandemic being likely, get ahead of it and start ordering. In the description of what happened, we had, a medium stockpile, 1 billion items. It was not particularly well organised, and it was not easy to get out of the single factory, warehouse. But we were nevertheless right to get going buying early, because even with that decision, we saw how difficult it became.
And an important part of that process is the topic I want to move on to with you now, the early investigation of PPE supply chain resilience.
Right.
In which you were involved.
Right.
In February, you attended a number of meetings attempting to gain a clear picture of the threats to global supply chains for PPE. That's right, isn't it?
Yeah, I was worried from the end of January onwards about supply for PPE because my view was as soon as this became global, if we were trying to order as much as we could, so would everybody else be.
And you were right.
On that one.
You were informed that FFP3 respirators were recommended, and you foresaw a surge in demand for those types of respirators.
Yes, it was blazingly obvious to me.
Was it not obvious to anyone else?
I don't know, but I was Secretary of State. It was obvious to me, and I pushed the system to try to act on it.
I wasn't sure if you were implying there that you had a battle on your hands to establish that point.
I don't think so, no.
No, all right. Public Health England had in stock 6.84 million out-of-date respirators that were being tested for shelf life extension. That's right, isn't it? It's in your evidence.
Thank you.
You instructed SSCL to increase its buying activities.
I did.
And you've mentioned a little bit about SSCL. They provided or supplied 250 main hospitals. They were. Do you want to say a bit about SSCL and what it did?
Well, SSCL was, from my vantage point as Secretary of State, where I wasn't involved in the detail of procurement until it became a crisis point, the purpose of SSCL was to have an efficient system of delivery of supplies to hospitals. And by efficient, you see, in normal times, that means carrying as little stock as possible. But in a crisis, that leads to lower resilience. And so the commendable drive in normal circumstances for value for money and for efficiency meant that when the pressure of a radical increase in demand met with a radical constriction of global supply, because everybody else's demand was going up too, the idea of having this just-in-time delivery system collapsed, and with it SSCL, and then some extraordinary individuals like Jonathan Marin and Emily Lawson, who've given evidence, stepped forward and put together the response. And the work that they did was absolutely phenomenal.
It wasn't until the 3rd of March of 2020 that you were provided with formal advice about PPE stocks.
Well, what do you mean wasn't until? We were discussing this in the department from January. I think this is an example of if you follow only the paperwork and you weren't there, you don't really understand the work that was going on.
Well, it's your 65. We can pull it up if you like. I was provided with further formal advice about PPE stocks on the 3rd of March 2020.
Well, there you are. Further advice. The bit of your question that was wrong was when you said it was only on the 3rd of March. I mean, that's the tonality of that is completely underplays the
When
work
were
that
you
was
previously
excuse me,
provided
I was finishing my answer,
Yeah.
thank you. The tonality of that question completely underplays the work that was going on from the end of January until the 3rd of March.
Mr. Hancock, that wasn't its intention. I'm sorry if that was how you perceived it. When did you previously receive formal advice as to PPE stocks?
I don't know. It's not the question of formal advice. It's the question of what we were doing on the substance that matters.
Let's have a look at that. 65 then, and 66. The advice noted a range of problems of sufficiency, if I can summarise it in that way.
Yeah, that's a good summary.
How did that advice measure up to that you'd been given when you took up office? Namely that the UK was one of the leading nations in the world in relation to pandemic preparedness.
Well, as I testified in Module 1, and indeed the inquiry found in its interim report on preparedness, the preparations that had been put in place were not adequate to the task. I mean, there was a much bigger problem than this, frankly, which was that the whole attitude to a pandemic was to allow the thing to wash over us and deal with the huge amount of death that would cause. And at this stage, as you'll know, no doubt from following other modules, I was not only dealing with PPE, I was dealing with other massive issues, the biggest one of which was trying to change the entire attitude to pandemic response to be one to try to stop the spread of the virus rather than simply deal with the consequences. PPE procurement was just one of many, many areas where that meant that we had to act differently to the inadequate plans that had been put in place a decade earlier.
It's one of the principal areas with which this module is concerned.
I'm sure. I'm just explaining the context because the necessary modular nature of this inquiry means that often context is missed in the questions.
You came to the view that the UK was going to run out of PPE in a pandemic. If we could have on the screen, please, INQ 000551276. It's an email from yourself of the 5th of March, 2020. On the constrained PPE market
Yeah.
and stock position, I think that's a reference to you,
Yep.
notes concern that we will run out. As discussed in the meeting this morning, he is worried about this from a comms or public reaction angle. Can we prepare a comms package to mitigate potential negative public response? Presumably, Mr. Hancock, your primary concern was not a PR one.
Absolutely not, no.
Yeah,
I didn't write this note, but of course there would be a comms consequence, but the comms consequence would be entirely driven by the fundamentals on this one.
Yeah, as one would expect.
Yeah.
You provide, if I may say so, a pithy summary of the position at that date at your paragraph 69 of your evidence, which I can perhaps just read out.
Just before we move on,
Yes?
it is worth also noting, just so nobody gets the wrong impression, the final bullet here, we need, in the thing that was on the screen a moment ago, we need to ensure adequate supply. So whoever's written up the note has put the substance in there. It's just that you've only highlighted the bit about comms.
Right. The summary you offer at 69, as at this point, the situation at this time was therefore that the market for PPE and other medical supplies was exceptionally tight. We were in competition with every other country in the world for key items. Our primary source for these items, China, had put embargoes in place, and international air travel and freight, particularly from China, was disrupted. Points that you have more or less made in the course of this morning.
Yes.
Yeah. So that was the challenge faced at that moment.
Yes.
Early March 2020.
Yeah. And remember at this point, by early March, people were dying. It was clear that this thing was coming in a massive way to the UK. At the same time, we were dealing with testing, contact tracing, getting the vaccine going, and deciding what measures to put in place to stop the spread of the virus, keeping the NHS going at the same time. So for context, this is one part of a much wider set of actions that we were undertaking.
So I now want to turn to what you describe as the collapse of the SSCL supply chain. Mm-hmm. That is a description that you give at paragraph 14 of your evidence. You say SSCL was overwhelmed by demand and effectively collapsed.
Yes.
What do you mean by collapse? It continued to function, didn't it?
It was no longer able to manage the supply of PPE to the NHS.
All right.
I mean, others were closer to the detail, and again, you heard from Lord Bethel this morning, who gave a more detailed set of examples of what happened.
You therefore, let's have on the screen INQ 000551284, which is an email of yours from the 19th of March of 2020, with a lot of recipients, I see, which starts, we needed more. I've been asked when I first became, sorry. This is the email in which you asked that anyone with testing capabilities be asked to come forward, and anyone with testing capability in line with standards to come forward,
yes,
such as universities.
Yeah.
So this is in March, 19th of March. This is before the call to arms that relates to PPE that comes later, isn't it? But it's an invitation for anyone who could help with testing capabilities to come forward.
Well, the context for this is that on the 19th of March, that was 2 days after I'd brought into the department responsibility for expanding testing. So the testing capacity, as has been frequently described, was very well stood up at a scientific level very early, but then PHE had failed adequately to expand testing and had failed adequately to engage with the private sector, and as a result of that, I had taken responsibility off them on the evening of the 17th of March, and this is 2 days later. So one of the things that we immediately did, that was in fact driven by Will War, was to go and find the testing capability, including, for instance, PCR machines that were distributed around the country in universities, and bring them into one place so we could optimize the throughput of tests. So that's what this refers to. Doesn't really refer to a call to arms from my reading of it.
No, I said I'm going to move on to the call to arms, which takes place on the 10th of April, later on.
Right.
Over the weekend of the 21st and the 22nd of March, DHSC officials developed the parallel supply chain, taking procurement out of the hands of SSCL and bringing it in-house to DHSC.
Okay.
Who approved that plan? Whose idea was it?
I can't remember at all. I may have ticked a piece of paper saying that we need to do this. It may have been a decision made at the operational level outside of my office. I can't remember. Can
you help us with why it was that the decision was taken to do this rather than support SSCL with further staff, contractors, seconded civil servants and so on?
It's a perfectly reasonable question to which I'm afraid I can't shed any light. I don't recall the nature of that decision, but there must be a huge amount of paperwork around it.
And in hindsight, do you believe that was the right decision? I
do, yes, because the pressures that we were under was absolutely overwhelming. SSCL had, as I say, collapsed, and simply the nature and the scale of the pressures were so much bigger than could be dealt with at the time, and it took us a couple of months to get from that position to back into a position of a structured ordering process. And no doubt we'll go on to some of the examples, but there was an absolute global scramble, and what the expansion pace that SSCL could have delivered was simply not fast enough, not least because their model didn't work.
So to those who say of this measure that it was the reinvention of a wheel, you would say the wheel was not fit for this purpose in any event?
That was my understanding, yes.
All right. Let's move on then to distribution of the stockpile. You say in your witness statement at paragraph 95 that on the 23rd of March, I formally approved a request from the NHS for military aid for PPE distribution. One of the problems at the warehouse where the PIP stockpile was stored was in deep storage in the northwest and not designed for rapid access.
Yeah.
So that we needed military assistance to physically get the stockpile to the front line.
Yeah.
That is put in rather more graphic or colourful terms in your pandemic diaries.
Yes.
Let's just see how you put it there. INQ 000 569 777. This is pages 6 and 7 of your pandemic diaries. It starts continuing to work. I don't think it's the bit that's highlighted there. Oh, there it is. Thank you. Continuing to work through practicality. Steve Oldfield updated me on the huge stocks of PPE in a warehouse in the northwest. 1 billion items. Just one problem. We can't get it out. It turns out that when they laid down the PPE stockpile in the 2000s, no one thought about the circumstances under which we might need it, i.e. an emergency, in which time is of the essence. It's in a huge storehouse unit which only has one door. Ergo, only one lorry can pull up at a time. This is a fairly basic or fundamental problem or error in judgment, is it not, Mr. Hancock?
It was certainly a massive problem for us, yes.
It meant that precisely the situation that this was put in place for was one in which it could not be, save with the assistance of the army, beneficially used.
No, that's wrong. It was beneficially used, but it could have been more beneficially used.
It was trickling out, wasn't it?
No, that is one of these terrible pejorative
comments
that you often make that's just totally inappropriate.
How would you describe it, Mr. Hancock?
It could not be picked as well and quickly as we would have liked and was needed in the circumstances. We've
heard from Mr. Webster on behalf of SSCL, who, by the way, took issue with the term collapsed. He didn't accept that SSCL had collapsed, but you've given your evidence on that.
Yes, and it's totally reasonable for the person running it to have said it hadn't collapsed, but for the purposes of what we needed and the massive increases scale, that is how it looked to me.
His evidence was that this warehouse was not designed to directly deploy stock to hospitals, but rather that the plan was to decant this stock to distribution warehouses. Was that also your understanding?
Well, in a way, it doesn't matter either way whether there was going to be an intermediary step. We couldn't get the stuff out fast enough.
What would you recommend be done differently to enable a better outcome in the future?
Well, what I put in place later in the pandemic is what we need in future, which is distributed stockpiles. At every level, there needs to be a stockpile. So every care home needs a stockpile. Every GP surgery needs a stockpile. Obviously, every hospital needs a stockpile. Then there need to be regional, essentially, stockpiles. I don't mean that in the formal sense that there need to be 9 around England, but I mean they need to be distributed across the country. They need to be structured so that they can be picked, preferably automatically and using machines. There needs to be a data system so that we know exactly what's in it when its sell-by date is. There needs to be regular audits of that stockpile. We need, as I mentioned in the next sentence in my book, more of an Amazon-style approach to delivery. Now, they have a just-in-time delivery system too, and if demand for a particular item multiplied by 100 times in the course of a couple of weeks and went into global short supply, I'm pretty sure they'd have a problem too. You know, it is inevitable that there are going to be challenges in the system when you put such colossal strain on it, but you can mitigate some of those in advance, for instance, by having a distributable and pickable stockpile.
SSCL was struggling with a surge in demand in January and February of 2020, weren't they?
They were struggling with the increase in demand already, yes.
Yeah. Do you think, again, on reflection, with the benefit of hindsight, that earlier deployment of the stockpile might have assisted matters?
Well, it's very hard to say that because we deployed it in January 2020, so it's hard. We couldn't really have deployed it much earlier.
All right, let's turn on to another topic I want to explore with you, if I may, Mr. Hancock. The call to arms, and by this I mean the PPE call to arms, the April the 10th call to arms. Yes?
Right.
Prior to the public call to arms in relation to PPE, which you made on the 10th of April 2020, the Prime Minister had made a call to arms for the provision of ventilators, hadn't he?
So I understand it. I can't remember the order of the dates.
Well, that may be the answer to my next question. Were you aware that this ventilator call to arms gave rise to very high numbers of offers of supply, many of which were non-starters?
Yes, of course. There has to be a triage system in any expansion of procurement.
Such that the team was struggling to assess those offers and to process them?
Of course, there needed to be a bigger team to do that, yeah. The size of the team was known when that call to arms was made, wasn't it? I imagine it was. I wasn't particularly close to the ventilator call to arms.
Well, let's move on to the one
that it happened and was involved in the discussion around it.
Were you aware that, in fact, many PPE suppliers answered the ventilators call to arms?
I no idea. I don't see the relevance either.
Well, let's move on and perhaps understand that relevancy. Your PPE call to arms came on the 10th of April 2020, didn't it?
It was the government's call to arms. I made it, yeah.
Whose idea was it?
I don't recall.
Not yours?
I don't recall. It might have been, it might not. Isn't that in the paperwork?
What was the problem that call to arms that you made, perhaps on your own account or perhaps on someone else's, was trying to fix?
We were short of PPE. We were radically short of PPE. The PPE was about to run out at a national level, and there were local shortages of supplies of PPE that we were aware of, and a lack of PPE has the potential to lead to death, including, and especially I was worried about, amongst health and social care workers. That's what the problem was.
Well, that's understood. Was there a shortage of offers of PPE that needed to be triaged?
We needed more offers to get more PPE, yes.
Let's turn to INQ 000536-362, please. It's paragraphs 31 and 32. It's from the evidence of Sir Gareth Williams. Starts at around this time. There was pressure from the then Secretary of State for Health and Social Care and from Number 10 for a call to arms in relation to PPE. This was initially planned for the 20th of March, but then postponed to the 23rd of March, and then presumably it was postponed further until April. Is that right?
I don't recall. I haven't seen this evidence before.
Do you know the reason for it being postponed?
Well, all I can tell you is here it says that Gareth understandably wanted a mailbox and a response team in place.
Yes, that's his paragraph 32.
Right.
It says, my office replied, he sets out various different things using a web form. He says it was necessary to avoid a situation again where people are sending emails all over the place.
Absolutely.
The request should specifically request details of specification, country of origin, and so on. And he says this towards the end of that bullet point. If it's anything like the response to ventilators, you will be inundated with offers, possibly even more, given some of the items are less technical than others.
Yes.
Yeah, and that is, in fact, what happened, isn't it?
We were inundated with offers, yes.
I know you followed some of this module to date. Did you follow Sir Gareth's evidence?
I've seen a summary of it.
All right.
But I also recall talking to Gareth ahead of this, which was probably in that period, from between the 20th and the 30th of March, about how best to do this.
Let's just turn up that evidence in case you've not seen it, and for the benefit of others. It's PHT 000150, page 50. where Sir Gareth has asked about the call to arms. But looking back, the call to arms was a mistake, wasn't it? It was counterproductive, to which Sir Gareth says, I can understand why it was needed, why politicians felt it needed to happen, but it had some very, very serious ripple, well, more than ripple. It caused huge problems, and a lot of the problems that the inquiry is rightly looking into, I think, flow as much from that as they did from our lack of stock to start with. So the question comes, it was an announcement that was counterproductive in terms of the challenges of procurement at the time. That's fair, isn't it? And Sir Gareth says, yes, the yield from the offers generated through the call to arms, rather than getting the industry into a room, which is what we did with ventilators, I suspect was marginal. Question, it's an example of ministerial pressure or ministerial interference proving unhelpful, isn't it? Yes, I wouldn't describe it as pressure. It was a decision that ministers took to engage the country against your advice, and then he says yes. Do you think, on reflection, and reflecting also on Sir Gareth's evidence, that there was any sense in which that call to arms proved to be counterproductive?
Well, it obviously led to more pressure because we were inundated with offers. The result of it was more PPE. And considering that there was such a lack of PPE, and we came, as you know, later within hours of running out as a country, I think a marginal, as he put it, even if it was only a marginal improvement in the supply of PPE, I would take it. And because my total focus was on saving lives. I understand that it caused more pressures in the buying team. And it is absolutely true that ensuring that we have as high quality triage as possible in any system is necessary. And I've no doubt that now that there is lived experience of what happens in these intense high pressure situations, that sort of triage system, which I wasn't involved in designing, could be designed better. But there's a big category error in this line of questioning that you put. And the category error is that it was a mistake to want more offers. What we needed was the best quality triage to get the most PPE that we could. And so having reflected on it and I did see this part of Gareth's evidence, and Gareth, by the way, did an absolutely extraordinary job. And it's true that the call to arms we made put pressure on him and his team. But I cared more about getting more PPE because we were all working all hours that God sent at this point. And nobody has testified that the PPE calls to arms led to anything other than more PPE. And indeed, it's in Gareth's testimony. And more PPE saved lives. So I stand by it.
Let's just pick up on that point before I turn to those pressures to which you refer. When you say it resulted in more PPE,
yes,
it's not possible for you to know what level of PPE might have been procured without that call to arms, is it? It's simply not possible.
You would have to argue that more offers of PPE led to less PPE for it to have had a negative impact, and that is hard to believe. Not least, Gareth's evidence was that there was an increase. He calls it marginal. I don't think that's the case, but an increase. Any increase was worth having at the time.
You mentioned the pressures. Let's turn to those. There was a call centre set up to deal with the backlog of offers, wasn't there?
Yeah.
MPs were escalating offers from time to time, weren't they?
Yeah.
Suppliers were threatening to go to the media with complaints.
Yeah, and phoning up the Prime Minister. I mean, there was absolute. You've heard the what I've called the pressures, the whole series of consequences of those pressures, yes. And by the way, these were happening before the call to arms as well, because it was so obvious that the country needed more PPE. You know, I had the head of the Royal College of Nursing, somebody who previously had owned a pub in my village, the editor of the Daily Mail, Martin Lewis from Money Saving Expert. I had all these people contacting me saying, we've got kit, can we help? That's what happened. And that happened because there were huge pressures shortages of supply, and because it was so obvious to everybody that unless you did everything you could, more people would die than otherwise. So people were coming forward with life-saving propositions, and we needed a system to deal with that. And my job, total focus across all of the different parts of my portfolio, was to save as many lives as possible, right? That was my total focus. And the end result of that was enormous pressure on all sorts of supply chains. We're primarily talking about PPE, but right across the board. We had to get as much in as we could. In some cases, we paid expensive prices for that, but I think that was worth it to save lives. And in the end, on PPE, we over-succeeded, right? We procured more than was needed and had to, I'm sure we'll come to dealing with the oversupply that we had at the end.
We will. Lord Bethell, to whom you referred and from whom we've heard evidence earlier today, says in his evidence that the teams dealing with the main route for referral via the portal were indeed swamped by unsuitable offers. You wouldn't disagree with that?
Of course, there were huge amounts of offers. Also, I'll say this. We knew when we went into this that some of the offers would be inappropriate or indeed fraudulent. And you'll have seen it, because I'm sure you've read all of the paperwork. There are references that were made within the meetings to ensure that we dealt with those sorts of proposals that were unhelpful, as well as obviously the proposals that were brought forward that were helpful. But the normal PPE supply chain was totally inadequate to the task that was needed. And the consequence, these were life and death consequences of whether we got more PPE or less.
And Nigel Boardman's review, with which I'm sure you're familiar, are you?
I contributed, I was interviewed for the review, but I wasn't particularly close to it.
Concluded that a number of organisations and individuals who were well-meaning but lacking the necessary competence responded to this call to arms and made the task of identifying the best likely sources of PPE more difficult to identify.
Yes, of course that's true, and some people came forward with fraudulent propositions, but the overall result was more PPE, and my job was to get as much PPE as possible.
So let's step away from that for a moment and just reflect on how the exercise might have been done better.
Okay.
I think you touched on that a few moments ago. Well, let me pose that initially as a completely open question.
Okay.
Yeah.
So I'm off the top of my head, but having reflected on this obviously over the years, the number one thing is that the industry and the suppliers who are already incumbents need to be properly and fully engaged as aggressively as possible. Okay, they are likely to be the core of the response. Secondly, bringing other suppliers who are already supplying those materials into your supply chain is absolutely vital. Third, trying to encourage others with the capability to pivot to very specific demands with clear specifications is absolutely vital. Fourth, you do need to leave open the proposition for creative proposals and creative solutions, especially from credible players. Layer on top of that the fact that a very large proportion of PPE was bought internationally, and this was part of a lack of resilience as a country that was there before the pandemic, and still is there to a lesser degree now. You needed the international element of this. So, for instance, one of the things we did early in this stage was we pivoted much of the action of the civil servants, Foreign Office civil servants who worked on the ground in China to helping to procure PPE. Then you need a triage system, and you do need to triage for two different things. You need to triage for initial assessment, and you need to triage for chasing. And you need a process that those who are approached, whether they chose to be or not, can put a proposal so that it can be adequately purchased. All of this needs to be done whilst removing the standard rules that slow down this process enormously, which are necessary and proper in normal times, but are are not adequate in these times. That's both the extremely rigorous checks, for instance, on background of suppliers, on the details of the shipments, and also on the price point, because the UK government has a standard procedure to go for a low price point, but when the price is moving up, that just means that we couldn't buy PPE easily because of those standard rules until the Treasury rightly suspended them for this period. So you've got this global demand, which is extraordinary. We've heard testimony of shipments being taken off being bought from us whilst they were being loaded into planes to come over to the UK. You have political involvement in every country around the world. The idea that this could just be done independently of ministers is not only wrong and unconstitutional for domestic reasons, but it was totally impractical. So there was one example where we were desperately tight about to run out of one particular item. I think it was gowns, I can't quite remember, at a national level. We got a supply from Turkey. Unfortunately, the fact that supply was coming got into the public domain, and understandably in Turkey there was a public outcry, why are we shipping off our PPE? And that supply was stopped on the tarmac when we'd sent the RAF out to pick it up. So all the questions that I've heard and the questions that I've responded to both at the inquiry and many times before, including in some of the court cases around this, far too often completely fail to understand the sheer scale of the challenge and the pressure. And so you have to put yourself in the mindset of what actually is going on at that time, including the real world pressures. And these aren't political presentational pressures. This is people dying, in order to then design a system that procures as quickly as possible. And Paul Dighton did an amazing job at getting that straightened out as things calmed down over the summer. But the one other thing I'd say, and this pertains to your questioning and this inquiry, is that you also have to protect the people who are making decisions at great speed, because some of the integrity of civil servants who gave their all in that time has been impugned since, and I fear that it will be harder to procure PPE in the future because people will look at the treatment that some of the people involved have received, including some of the sort of undertones of some of the questioning, and think, I'll just run a mile in future. Whereas instead, what actually happened in the pandemic is people leaned in, and that's what you need in a crisis of this scale.
Mr. Hancock, you've given a very long answer, but it's my fault because I asked an open question.
Yes, feel free.
But there are, if I'm sure, helpful parts to it. I just want to ask you about some of it.
Yeah,
in summary, you would advocate for, you would recommend a more focused approach to procurement, but allowing for that pivot aspect, i.e. to the possibility of suppliers that were not conventionally manufacturing, say, PPE, but could do so.
And creative potential solutions that you haven't thought of as well. Yes.
Yes. So far as the protection of those, so to speak, on the factory floor, those toiling hard to
buy the kit.
To buy the kit, who are procuring long hours.
Yeah.
You refer to possible adverse effects of the inquiry or the media in terms of those individuals. I want to ask you about the protection of those individuals within this process at the time.
Absolutely, that's important too, yeah.
Now, you say that there should be triage for assessment and for chasing.
Yes.
Should they be separated?
Well, they necessarily have to be connected, because you need to know. So the precise details of the design of it, we could work out in slower time, but it is necessary to have both, and there needs to be a connection between the two of them. For instance, I've heard the chair ask previous witnesses, would you go for this traffic light system? Well, a traffic light system is a high priority, medium priority, and low priority triage. We, in the end, had a high priority and everything else triage. There isn't much difference between the two. What you need to do is design a system that has triage and allows for interrogation of where things are up to and they do need to be connected, but I'm sure they could be designed as efficiently as possible.
Mr. Hancock, what you've not referred to, but I'm sure you would agree would need to form a part of this, is the smart use of data.
100%.
The arrival
vital.
at an early stage of all the data that is necessary, or as much as possible of the data that is necessary to form a view on an offer.
Yes.
Front-loaded into the system.
Absolutely. And knowing that the progress of any particular offer is updated accurately in the system, so anybody chasing could just go into it and say, well, this is where it's up to. Yeah.
So what you have described, or what you have recommended, is different to what came into being.
Of course, because we had to design it from scratch.
Absolutely, and a large part of the purpose of this inquiry is to learn lessons.
Yeah.
You say in your evidence that you were not involved in the setting up of the high priority lane.
Sure.
It follows, I think, from the answers that you've been given, that with the benefit of that hindsight, you wouldn't reinvent it, you would invent something that was better, that was more effective.
You need something, right? So as Secretary of State, when I before or after a public call to arms, irrespective of a public call to arms, as Secretary of State, I received proposals. And as I'm sure you've seen from all of the paperwork, what I did with those proposals was I pinged them onto the system. In the first instance, I sent almost all of them to Jonathan Marren. In some cases, I would send them to Private Office or Lord Bethel, particularly if somebody was being particularly difficult, to be honest. But if it was a plain vanilla offer, I'd send it to Jonathan Marren, and then when I heard about the setting up of the high priority lane, I would ping it onto the high priority lane. You do need a system for that, because when an offer came to me, it would have been a dereliction of duty not for me to pass it onto the system.
You do need something, absolutely. I don't know whether your following of this module included early on in week one when Professor Sanchez-Graells gave his evidence. His evidence, with which, on this point, no one has disagreed, is that there is no equivalent of the VIP lane to be found abroad or in the devolved administrations. Do you know of one?
There are endless examples across government when in particular, an MP or a minister has a challenge, a request of government, that they are able to get a response to it. Lord Bethel referred to the scheme for Ukrainians. There are endless.
Not quite my question, Mr. Hancock.
It is my evidence is that it is absolutely standard practice across government. So I was not at all surprised when one of these was set up.
Let me re-put my question. We're talking about the context of procurement, and we're talking about whether, within the experience of the pandemic, it is possible to find abroad or in the devolved administrations. I'm not focused on Ukrainian refugee allocation, accommodation allocation.
Well, you may not be, but you say within the confines of this module, and as you know, this is a challenge of the modular approach. It is absolutely standard in the UK government to have a process for the triage of requests.
Do you know of an example of emergency procurement in the pandemic of a VIP lane of the type that existed here, elsewhere?
Every single country had a process to try to buy more PPE. The evidence, which I heard it on the Today programme rather than the inquiry, I thought was completely flawed. Because the problem with some of the analysis around this, and we've had it in some of the other evidence, is that it tries to pretend that these were normal times. There was a court case back a couple of years ago where they found that some of the paperwork was filed in public a couple of weeks late, and that was deemed this great catastrophe. It wasn't a catastrophe. People were choosing to save lives instead. And the reason I'm answering your question in this way is that I think it's a entirely subjective view as to how different countries responded to the problem, that people would contact ministers and others, like MPs, like senior civil servants, like senior clinicians, and say, I've got an offer, and what you need to do is get that offer into the system as quickly as possible. And it's become this great big thing, and frankly, we're going to have a system to do something similar in the future. I've no doubt that the next time there is a pandemic, people will email the then Secretary of State, and she or he will need a system to be able to send the requests they receive onto. It's an inevitable part of life.
Your own system, Mr. Hancock, would have that person feeding into
a triage,
a data-fed system, information about the offer that would populate a live platform.
Yeah, but there you go again, discussing a perfect world. Absolutely, we should design a better data-driven system for the future. Of course, better use of data would be a far better way of doing this in the future than essentially starting from scratch and from then building it on a spreadsheet. But the problem is, the reason I've answered in this way is that, frankly, the questioning on it has been wholly naive to the circumstances that we faced.
Let's just
Hancock, could you just? I think you're seeing hostility in the question.
I certainly am. It's totally understandable.
Will you let me finish, please?
Oh, sorry.
There isn't hostility. It's about what could we do better in the future, understanding what the system was like, what all the pressures were like. I can assure you this isn't about saying, oh, well, they should have had this perfect system in place, it's all their fault. You could argue they could have done more by way of preparedness. You've accepted that. It's about how can we do it better when the next pandemic comes. So it's not intended to be hostile.
Thank you for clarifying that. What I would say is that that is how I took the questioning when I was being asked how to do it better in the future. When then asked a question specifically about has anybody else in the world done it this way, my answer, I suppose, my considered answer is every country will have, I don't know what these systems were like, but every country will have had some kind of system for dealing with this problem. And forgive me for being impassioned on this point, but I have been subject to enormous amounts of conspiracy theories about what went on here, when in fact what happened was so many people working as hard as they could to save lives, and they bought more PPE as a result, and therefore people are alive who would otherwise be dead. And frankly, I'm incredibly proud of the people who themselves have felt under attack because of the way that questions have been put, which does have a material consequence on future responses to a pandemic.
Mr. Hancock, it's only right that you should have an opportunity to respond to the part of Professor Sanchez-Grael's evidence that relates to this. I'm just going to put it on the screen and invite you, I'll read it and then invite you to comment on it, all right? It's INQ 000539153, where Professor Sanchez-Grael expresses his view on the VIP lane. In my view, it says at the bottom, it says no.
It says turn it off and turn it on again. That's a new one.
Was it?
Just read it out.
Oh, OK, I'll just read it out. In my view, the VIP lane also fell short of several applicable requirements and is problematic from a broader perspective. The reasons for its creation are unpersuasive, as there were alternative measures that could have been put in place without creating preferential treatment at triage stage. There was no consideration given to the risk of de facto differential treatment that the pressure stemming from regular requests for updates and the labelling of offers as VIP could have, or potential confusion as to what VIP signalled. There was no consideration of the fact that a referral by ministers, MPs or senior officials was not a justification for preferential treatment. Do you wish to comment on that paragraph?
Well, at one level, I of course agree that a reference of from who an offer was triaged through doesn't impact automatically the likelihood of that being worth pursuing, but it does have some informational value. And what I would say about that particular paragraph that you read out is that it is wholly naive as to the circumstances that we face. And I believe that Mr. Gove gave some pithy evidence as to his view of this particular bit of evidence in the inquiry, with which I wholly concur.
Certainly, he did comment on Professor Sanchez-Grael's.
But the point about naivety is really, really important, okay? It's fine having academics write papers about this stuff. And some of the academic analysis of how you could do better in a future pandemic is really, really valuable. But it can only have any value at all if you understand what it was like. You know, you weren't there. This professor wasn't there. But you've got to understand what it was like. And that's why I'm trying to get this over. The pressure to save lives is intense, but so is the reality that high-quality offers will come through and be sent through to senior decision-makers. And you have to have a process for dealing with that. I didn't design this process. I've no reason to defend it, but I do care that this is done well in future. And I didn't care if an offer came through me and somebody had to go back and say, I'm terribly sorry, we're not taking this one up. I didn't care either, and there's loads of paperwork of me just saying, well, please go and tell them appropriately, right? What I cared about was getting PPE, and I worry, and the reason I keep repeating this point, this emphasis, I worry that well-meaning but naive people are going to get this wrong for the future and leave more bureaucracy in a future emergency procurement than is relevant at the time, and then the Secretary of State at the time will set that aside and we'll end up having to invent something from scratch. If we're going to invent something now, let's invent something that is going to actually work when the proverbial hits the moving object.
Mr. Hancock, you also care about the protection of those involved in emergency procurement.
Absolutely.
Yeah. And one of those individuals was Chris Hall.
Yes.
Yeah. And we know from his evidence, perhaps we could have it on the screen. My screen seems to have come back to life. Is yours functioning,
yes.
Mr. Hancock? Great. INQ 000536369. He is, in this part of his witness evidence, talking about complaints about particular offers that have been made, delays in the system.
Yeah.
He says ultimately 624.
Yeah. Tell me about it.
Or was it 625? Ultimately, many of these complaints would be referred back to the HPL mailbox by the official or minister who had received the complaint. This simply added to our existing workload and required time to investigate and to explain to hard-pressed ministers who had in fact happened, what had in fact happened and why the offer had not proceeded further. Now, if we can move from there, thank you for that, to INQ 000527557 and page 2. There's an email from Chris Hall. And then if we go up to the top of this, Alan Nixon says, thanks, Chris. Mammoth effort from you, your newly established team, and I really appreciate the note setting this out. We'll keep trying to insulate you and your team from things like this, unless absolutely necessary. Problem was, this one came direct from Matt, who I assume is yourself.
Yeah,
Hancock.
that would have been me, yeah.
And he'd asked for an answer on it. I've spoken to him and he's happy,
yeah.
As is the MP.
Yeah.
So it's an illustration not just of the pressure or the increased pressure that is brought to bear on those, and we touched on this earlier at the end of your quite lengthy answer, Mr. Hancock, how to protect those individuals who are working hard and long hours to achieve what they needed to.
Yeah.
This is an example of where you yourself are contributing to that additional pressure. Is there any way out of that?
There needs to be a system that takes this into account. Please zoom out.
Yeah, you want to see above that?
Because I want to see Chris's response.
Yeah,
all good, and we really appreciate the support we're getting from Matt and the political team, right?
Yeah.
So absolutely, I would refrain from putting this kind of pressure on unless there was a good reason to do it. For instance, if the particular chasing came from somebody who we were also in discussions or negotiation with on some other matter, then it would have a material consequence. So you've got to have a system that takes this into account. And this is why I disagree with this assessment that such a system didn't exist anywhere else in the world. That can't be true, right, in my experience. I haven't been a minister in any other government, so I don't know these sorts of pressures exist in reality. If we try to design a system to pretend they don't exist, or worse, to say these pressures exist and what we're going to do is tell the senior people, stop putting this pressure in place, then it will fail, right? I would not have gone to Chris with a request unless there was a good reason to do so. And that's why I respond in this way, is because my motivation was to get as much PPE as possible. I was also at the same time dealing with a dozen other subject areas, and I had to make decisions as appropriate. Senior leadership sometimes involves asking what's going on in one area because of something important going on in another area. And so you do need a system that deals with this, yes. And you can't just say, let's just ask people to ignore those pressures because they are real.
All right, Mr. Hancock, let's move on from the VIP lane. You anticipated that we would come to excess PPE or overpayment for PPE. I want to do that with you now, if I may. You said in your witness statement at paragraph 16 that the procurement teams, as we've been exploring, were under immense pressure, and that in those circumstances, you don't expect everything to be perfect, so that when action was taken that can later be criticised, for example, overpaying for a consignment of PPE, you don't apologise for a minute, because you had one goal, and you said this several times today and in other modules, and that was saving lives.
Yes.
You say, while of course theoretically there is a limit to this approach,
Yes.
we were nowhere near it.
Yes.
And would you apply that to both prices paid for and surplus amounts of PPE and other urgently needed medical kit?
No, I think that refers only to prices paid, I think, in what you read out from what I said. In terms of oversupply, obviously, what you want is the perfect quantity, right?
Yeah.
That's obvious, but it's also extremely hard to deliver.
Yeah.
My instruction to the team and my bias, and by the way, it will be the bias of whoever is health secretary next time there's a pandemic, is more rather than less. And they achieved more rather than less. The oversupply was rather larger than I anticipated, but it is better to have more, to err on the side of more supply, because if you err on the side of less, then you run out, and we got very close to that.
I think Sir Christopher Wormold said that he would rather be sitting there saying that we had too much than that we had too little.
He's absolutely right.
Yeah. When you say that your own view is that we rather oversupplied, can you say by a factor of what? I mean, did you form a view as to how much of an excess it was?
No, it's very hard to say because, firstly, by then, Paul Dighton was running PPE supply and doing it brilliantly. Secondly, it depends how much you can put into a future stockpile. So I was asked in 2021, for instance, to dispose of some of the PPE, and my view was that we should put it into a future stockpile, not dispose of it. But that's a difficult and very practical matter, what can be stockpiled, where it is. And so there's an important administrative task of dealing with an oversupply. Exactly how much was oversupplied is actually impossible to tell, because it all depends on what you can do with it.
Well, we'll come back to that. I just want to go to the previous point, which is pricing.
Yes.
And you're quite right. The bit that I read out was relating to pricing, but I wanted to ask you about both aspects at the same time. Let's turn to INQ 000888616 and page 6 of it. The minutes of the 20th of April 2020 COVID-19 Strategy Ministerial Group.
Yes.
This records you as saying that the current rules state that the government should buy at 25% below market value. Was that the position at the time?
That is the standard normal times position of Treasury in terms of public sector procurement.
Well, clearly that's unachievable in a crisis such as this.
Correct. And when I brought that to light of Rishi Sunak as Chancellor, he removed that rule.
He said that we should buy above market value in order to become a go-to customer for global suppliers of PPE.
Yes, there were stories, I don't know whether they're true or not, of the CIA turning up with literally truckloads of US dollars in China in order to buy a kit. We didn't do that, but that was the sort of thing that we were dealing with. And you've heard other stories of losing supplies when they were on the tarmac. I mean, so... And when a price is rising, if you're trying to buy below par in a rising market, you just get nothing at all. So that rule was a problem for a period, but as soon as it was brought to the Chancellor's attention, he suspended it. It is, of course, totally reasonable in normal times.
What did you envisage it being necessary to do to become that go-to customer?
To pay above par.
And how much?
That was entirely a matter for people on the ground.
You've made reference at numerous points in the course of today to the fact that you had many responsibilities within your department: vaccines, therapeutics, IPC guidance, test and trace, and so on. All of them required some form of budgeting, didn't they?
Yes.
So you presumably needed to keep a close eye on that which was budgeted for, say, PPE procurement, and ensure that there was enough in the coffers to allow for other expenditure.
No, that's not really how it worked in the pandemic. Because of the extraordinary circumstance, as a department, we were able to draw down on the Treasury Reserve, and indeed the Treasury issued a huge amount of debt in order to pay for these costs. So that the management of that was, obviously I cared about how much money we were spending, but I thought that was second order to stopping the pandemic and keeping people alive. I essentially delegated the day-to-day management of that challenge to David Williams, who, of course, engaged with civil servants in the Treasury. And frankly, the system they put together was exceptional, and they are exemplary in their service. I only got involved when something then needed to be escalated to ministerial level in Treasury.
We'll come on to the relationship between DHSC and Treasury in a moment, and we've heard some evidence that relates to that. Steve Barclay appeared earlier in this module.
Yeah.
But I just want to ask you this point. In a minute of a meeting of the 21st of April, so the following day, you indicated that the government needed to take a dynamic approach to pricing and be willing to take on extra risk.
Yeah.
What did you have in mind there by extra risk?
Oh, to be able to pay above par market value. So my attitude, I basically took a risk-on attitude to many areas in the pandemic because of the scale of death that we were facing. I took a risk-on attitude to legal risk. I took a risk-on attitude to making decisions that may not have had the formal minute. I referred somewhat grumpily to your reference of the first formal advice I had in early March on PPE procurement. That's because we weren't doing formal advice at this point. We were getting on and buying stuff. So I took the risk-on attitude here was to be prepared to pay above market value, which normally I would have been pretty aghast at. I was the Minister for Efficiency before I was the Minister responding to COVID, and so I found it quite uncomfortable, but it was necessary to save lives.
It wasn't the risk of over-procuring.
At this point, I was not worried about the risk of over-procuring because we were desperately short. That became I think the question's referring to about April, May 2020. The risk of over-procuring hove into view later.
Okay. Let's just pick up on this point that we, as I said, we heard evidence from Steve Barclay.
Yeah.
He, along with Lord Agnew, who did become a Minister for Efficiency, and he had various other roles.
As well, yeah.
Expressed a degree of frustration at the sums that were being asked of the Treasury at very short notice.
Yeah.
In fact, Mr. Barclay invited the inquiry to seek evidence from DHSC as to why such little notice was given.
Yeah.
I think both of those witnesses felt that by the time they'd received the request, given the short timeline, it wasn't possible to apply
normal levels of scrutiny.
Normal or even any meaningful level of scrutiny Lord Agnew refers to a particular request for 1.25 billion with a turnover time of 24 hours.
Right.
So can you comment, can you help the inquiry as to why the deadlines imposed, even for sums as large as that, were so short?
Because we were in a desperate situation with, this, if you're referring to something, I think in about May 2020, there were just under 1,000 people a day dying. And we had no idea how long the pandemic would go on for. And there was a high degree of skepticism as to whether a vaccine would be successful. So sometimes actions needed to be taken very quickly. As I say, I understand those frustrations. They're natural frustrations for a Chief Secretary to the Treasury and a Minister for Government Efficiency in the circumstances. I wouldn't have been close particularly to the individual procurements or spend because I wasn't close to any contracting other than on vaccines. And really, David Williams was the person I turned to for those questions.
They were, as you say, exceptional circumstances. The normal rules, regulations, norms did not apply as between DHSC and the Treasury.
Rightly so.
You say that you told Sir Chris Wormold that we deal with any legal headaches later, and the primary goal above all else was to save lives. And that's a phrase I think you use. Let's just turn up the document, INQ 000550, paragraphs 10 and 11 of your statement, I think.
There you go.
Pages 10 and 11, I beg your pardon, it's para 48. Yes, what did you have in mind there, the legal headaches?
Oh, for instance, if the statutory declarations is a good example. There are a whole series of. As Secretary of State, you inhabit a world constrained by a statutory and common law framework, which is entirely right and understandable. In normal times, working through that can be frustrating, but is proper. And there are some ministers who rail against it more fulsomely and publicly than I do. I actually think that working within the rule of law to get stuff done that is basically the job of leadership as a Secretary of State. And if you really don't like the law, then you have to seek permission to change it, and that takes time and brings in further constraints. That is how you operate. That is the statecraft of being a cabinet minister. When you have a calamity of this scale facing you, when you realise that you are going to be the Secretary of State facing the first global pandemic in 100 years. And when you know that the death toll, if you don't act and lead, is going to be in the hundreds of thousands, the estimate in January was 800,000 people dead, then you are prepared to lean into that and deal with, as it says, legal headaches later. What mattered was appropriate action to save lives, and that is what we did.
I'm just trying to focus on my question. You said statutory
declarations, yeah. So I'm referring to the court case I mentioned earlier.
Contract award notices.
Contract award notices, is that what they're called?
This is the notices of what the procurement awards that have been made.
And we're a couple of weeks late with some, and there was then a case about it, and the whole thing was ludicrous.
Yes, indeed. And you had that. Well, I'm not sure that it was ludicrous, but I understand what you're referring to.
Yeah.
That's what you had in mind, is it? Or,
yes.
Or anything like that?
That sort of thing, yes.
All right.
I can give you another example. We had to change the law with the Coronavirus Act in order to remove a whole series of restrictions that made it difficult to act quickly. So that's another. Yeah. In that case, we changed the law.
My lady, I see the time. I'm very close to the end of this topic. I'm in your hands.
Yes, I think we'll break now, and I'm issuing a warning to all advocates. The inquiry has given an undertaking to the last witness of the day that he can catch a flight back to Northern Ireland. He will get that flight if I have anything to do with it. That means that all advocates are going to have to think about restricting their questioning, and we will finish Mr Hancock before the afternoon break, and we will finish evidence today at the very latest by 4:30. Thank you.
Bye.
Mr. Ward.
Thank you, my lady. Mr. Hancock, final furlong. We had almost finished with excess PPE. We dealt with pricing. I just want to finish up with the amounts or the quantity of excess.
Yeah.
It might be convenient just to turn up a document so that gives us a sense of that. This was drawn to the attention of Mr. Marin at the beginning of his evidence, but I'll draw it also to your attention. I hope we can agree figures from it. It's a DHSC document, INQ 000534966. It's a document produced by Peter Howard and sent to Jonathan Marin. And what we see, if we scroll down a bit, please, and a bit further. That's it. Table 1, snapshot of volume and value of excess stock from the 7th of June 2021 with high assumptions for demand. This is by items in billions.
Yeah.
It results in an excess stock amount of 6.9, but we need to reduce that down, and we'll look at the paragraphs that follow in order to do that.
Could you just tell me the date of this note?
Yes. If we turn to the top of it, I hope it's got that date on it. I think it's towards the end that it's 28th of July 2021.
So I obviously haven't seen this because I wasn't Secretary of State at that point. So this will have been a note to Secretary of State Sajid Javid.
Yes, you may not have seen it at the time. I think you've seen it in advance of today's hearing, have you not?
Impossible to remember this.
All right. Well, I don't think that's a critical point for these purposes.
No, but the point that matters is that SOS there is Secretary of State, but that's not me. That's
yes, different
Sajid,
individual.
Yeah.
But what we have here is a snapshot of what the excess PPE position was.
Yes.
At this date.
Yes, large. Yes.
It's very large.
Yeah,
isn't it?
enormous. Yeah.
It's enormous, and you said earlier that it was larger than you would have certainly hoped, that you would have expected. I pressed you to see whether you could give any indication of by how much. I think that was a difficult exercise for you to conduct. And I appreciate that there were many, many variables in play at the time, weren't there? Whether a vaccine would become available.
Yeah, you see, exactly. So the thing is that these figures obviously are the best estimate at the time, but they're also unknowable. If the pandemic had carried on for another year, then we would have used 6.9 more billion items. If it had ended sooner, the stockpile would have been even greater. You know, so it's a very hard thing to judge. As it happens, once Paul Dighton was brought in, then those judgments ultimately on purchase were for him. So I wasn't particularly close to it at this stage, and this note is about what then to do with it. But it is obviously that's a very large number, and I would have hoped most of that is laid down in storage for next time.
And it's put into pounds, shillings and pence at paragraph 3 beneath it. The PPE network in the UK is currently storing 1.3 million pallets of PPE. This costs the department in the region of 300 million per year in operational costs, mainly storage. At current pandemic usage, we estimate that £3.8 billion of stock will expire before it can be used. So there's a deduction there because some of it will achieve beneficial use within its lifespan.
Well, who knows? Because we don't know when the next pandemic's going to strike. My point isn't to be defensive on this, it's that these figures are the best estimate. Working out how much PPE you should stock is difficult. You don't know how long a pandemic's going to go on for when you're responding to one. Obviously, it's self-evident and sort of banal to say that you want to buy the right amount of PPE, but nobody's going to, in practice, get that exactly right. We clearly we as a nation bought more than was necessary. The July 2021 estimate of that is here. The learning is try to buy the right amount. Well, sure.
Well, the only reason for the point I raised, and I don't want to labour it, is that even absent a pandemic, there is a degree of use of PPE.
Sure, yeah.
So that
on the run, yeah.
And that's the basis upon which these figures are reduced down.
As best you can.
Yeah.
Yeah.
All right, let's just have a look, as best we can, at how the UK compared in terms of its over-procurement with other countries. Could we have INQ 000474994? And we've got a couple of graphs here provided to us by UK ACC, who have given evidence within this module. You'll note at the outset that this doesn't relate only to PPE, but it's total cumulative COVID contract awards, here initially awarded in direct and negotiated procedures without publication. And you can see that on this chart, the UK is a significant outlier compared to other countries, Germany, France and Poland.
This, in my understanding, having not seen this chart before, my understanding from the words in the title is that this is entirely meaningless because we have a national publicly owned single purchaser health system, whereas Germany, France, and is that Poland? I don't know much about the Polish health system, but I know a lot about the French and the German, and they don't. So it's a meaningless chart.
All right, let's, well, just for completeness, I hear that evidence. The chart below it relates, you've got the sums involved down the x-axis, cumulative value.
Yes.
You'd say equally meaningless.
Yeah, because in a privately run system, even if it's got nationally required insurance, like the French system, what's directly procured by central government is different. It's just the chart might as well be stating that there are two different types of health system and that we're the only one out of all these to have an NHS. That's what it tells you. Other than that, there is no factual value in this chart.
All right, Mr. Hancock, I want to now ask you, you've been asked about ministerial pressure. I also want to ask you about the pressure that was placed on ministers. Okay. Such as you, by others.
Right, yeah.
And there was no shortage of that, presumably.
By others and by circumstances, yeah.
Yeah. Now, one of those others, without levelling any criticism at her, was Dame Donna Kinnair, who placed you under a degree of pressure when she contacted you directly about gown shortages.
For context, she was the head of the Royal College of Nursing, so it was entirely appropriate that we should be in contact. And what would you have done?
I didn't suggest otherwise, and it's not my role to answer questions today. This is presumably someone you would have wanted to maintain a good relationship with.
Yes, that was very important.
Of course. You were very concerned about frontline workers and knew that they were at risk every day working on the front line.
That's correct.
Yeah.
As was she.
As was she. She represented their interests quite directly, didn't she?
She did, yes.
Yeah. You were probably aware at this sensitive time that a negative interaction with Dame Donna Kinnair might have political repercussions and might risk losing the trust of nursing staff, which would have been a problem.
Yes, I'm not sure political is the right word, because it wasn't about, none of this was about party politics. That was irrelevant. But I was in negotiations directly or indirectly with Donna Kinnair on a whole series of different subjects at any one time. For instance, you know, the ratio of nurses who might be looking after people in intensive care, the rules around protective equipment and what people should be wearing. So it was a very important relationship to maintain.
Yeah. We know, perhaps let's have it on the screen, a display INQ 000536369. I think this is an excerpt from your, yes, Chris Hall's evidence. I was contacted again, says Chris Hall, by Matt Hancock on the 16th of April. He expressed concern that Donna Kinnair would go to the press with criticism of the way in which his department was procuring PPE and asked why we were not able to proceed. So that presumably is an illustration of the sort of pressure you were experiencing as a result of this intervention from Donna Kinnair.
Yes, I don't think that Donna Kinnair, I can't recall Donna Kinnair ever having directly threatened me that she would go to the press, but she was in the news a lot, and there was a lot of there were a lot of questions being raised about PPE supply. But this is a reasonable description of the dynamics that we were living in.
Let's display INQ 000551316, please. And this is an exchange of messages between yourself. I think you're the owner of the cell phone in this exchange.
Yeah.
Donna Kinnair, to you. Are we going to need to talk about what we do about the shortages of gowns coming over the horizon? And then why can't we use waterproof tablecloths and other suggestions that she makes?
And recycling gowns that are intact.
And recycling gowns that are intact, exactly. Also, if this 96-hour quarantine, you respond, yes, that's a very good argument. We're looking at all options. Very important to keep the front line on side and supported, you say.
Yes.
To which she apparently interprets as a point of PR. She says, this isn't a PR job. We are on side. We are going to work. I am volunteering.
Yeah.
But already this morning, leaders are telling those requiring PPE yesterday to forget it today. I'm very concerned.
Yeah.
And then she mentions to you the possibility of a supplier, George Farha, whom she describes as one of your party donators, and my friend can get FDA-approved gowns here by Wednesday.
Yeah.
And he knows how many you want. To cut a long story short, you helped to take that forward, did you not?
Yes, you'll see it in the, no doubt. It'll all be written in the messages. What I expect and what I can recollect happened is I said, please send in the proposal, and I then sent it on to the team. That's what I generally did.
It resulted in a contract for 10,000 gowns, did it not?
I subsequently discovered that. I didn't know about that at the time.
There were other offers made by Mr. Farha, and they are, can we have INQ 000551372, please? This is Chris Hall, I think. To you, I'm sorry, but I've some disappointing news on this deal. So this was a separate deal, not the 10,000 gowns, but something else that Mr. Farha was offering as introduced by Dame Donna Kinnair.
Okay.
I have some disappointing news on this deal. We worked intensively with George and his colleagues over 5 days and so on. The deal would have involved £6 million being at risk at any one time through a company with very little capitalisation, while George offered bank guarantees of up to 0.5 million at the last moment. This was not enough to convince DHSC colleagues that it was an acceptable risk. We'll keep exploring options and so on. In the end, this set of exchanges, took up quite a lot of time, including your time, resulting in a relatively small number of gowns, didn't it?
Well, there were many, as we've been through this before. There's proposals that work well and there's proposals that didn't. And what you can see in front of us is my response, which is entirely appropriate. Thanks for letting me know. It's not like there's no there's no pressure applied to Chris Hall to do anything about it. It's entirely proper. And no doubt, having read all of my correspondence, you'll know that that was exactly how I treated all of these proposals that came to me.
Mr. Hancock, I must urge you to be a little bit less defensive. No one has accused you in this email string of impropriety. All right?
Carry on then.
What I want to know from you, we touched on it before lunch. You were devising methods of improving the system, and we started to explore the possibility within a parliamentary democracy of controlling or moderating the input that some may regard as inevitable, either from ministers or from individuals such as Dame Donna Kinnair, to find out what's going on, to recommend suppliers of urgently needed gowns. Now, first of all, do you think that type of intervention is ever problematic, was problematic on this occasion?
I'm not quite sure what you're getting at. If you're going to have to ask a better question.
Well, thank you for your comment. Did you welcome Dame Donna Kinnair's intervention?
I welcomed the proposal of more PPE, and I sent it into the system. It also had the characteristics of a response that I needed to maintain was properly looked at. Even if the result of it was not successful, it needed It needed proper handling. It's a really good example of why it would be naive to suggest that ministers shouldn't be involved in this, notwithstanding the constitutional point. It happens in these sorts of circumstances.
Now, Mr. Hancock, you said again before with the short adjournment that you were concerned, to put it lightly, at the welfare of those who were actively engaged in emergency procurement.
Yes.
Yeah. One of the ways of protecting them, of safeguarding them, is to provide as much transparency as is possible about offers that come in to their attention. Would you agree with that?
I don't know. Depends on the circumstances.
So last week, Mr. Gove was taken to a number of emails in which he was described as a friend of Mr. Mellor.
Right.
He said that the reference to his friendship was a way of signalling to others that the offer should be treated scrupulously, should be treated without offering any favours to Mr. Mellor.
Right.
There are alternative methods of dealing with an association or a friendship such as that, such as declaring the association,
right,
but adding a caveat that no preferential treatment should be given.
Yes, the thing is, I saw that exchange, and again, I'm sorry to keep having to come back to this. The circumstances at the time were of a shortage of PPE, enormous numbers of people dying, and a huge amount of pressure. So when I was responding to that email or those messages, I'll have been dealing with 100 such messages at the same time. And so I saw this implication that, an appropriate and proper disclaimer should be put on every email. It's just not what happens in the real world. And so the naivety of the questioning is a bit of a problem.
Mr. Hancock, let's focus on your evidence. I want your view.
You asked me about his evidence, so forgive me for answering.
Whether you agree that repeated references to a friendship are a sufficient method of signalling to those others involved with triage and processing an offer that no favouritism should be offered.
I think that it's absolutely reasonable, but not the only way of dealing with it.
What are the other ways of dealing with it?
Well, making sure that whenever you send on a proposal and it's rejected, that your response is no problem. Making clear that your sole objective is to procure more PPE wherever it's necessary. There's lots of different ways of doing it. You could do it within the triage system. That's one of the reasons that we had the triage system, that we had a triage system, so that people like Chris Hall could say, I can't recommend this, and then it wasn't recommended. In fact, there's a benefit to that, which is that I could then go back and say, I'm terribly sorry, this isn't going to work, because it hasn't got through the gateway. So there's lots of different ways you can deal with it.
You deal in your witness evidence with Hinpack and Alpha Laboratories.
I do.
You do. You were first contacted by Alex Bourne by WhatsApp on the 30th of March 2020, weren't you? Sorry, not first, in relation to this.
Yeah.
Presumably you had been contacted previously. He had your number.
He had my number because he was a constituent. So as you mentioned at the start of this session, I had two roles, one as the MP for West Suffolk, the other as Secretary of State.
Was that the extent of your relationship with him?
Essentially, yes. I'd been to a constituency event with him beforehand.
Not a friend?
I didn't know him before he became a constituent, and he had my mobile number because many constituents did. Was he also your pub landlord? He had run a pub in the village, which I'd opened, but he's not my pub landlord, and he also ran a plastics factory, which is an entirely reasonable enterprise. Previously, he had served with distinction as a soldier in the UK Army. He's a man of high integrity.
Can I just have up on the screen INQ 000 551 393, please? He contacted you on the 14th of May as he had approval to make test tubes for antigen tests.
Right.
He was also hoping to get sign-off to produce saliva test kits to be assembled, and that is why he contacted you. You passed on his communication to Lord Bethell, didn't you?
Well, that's what this shows. Yeah.
And we've heard evidence to that effect earlier today from Lord Bethell himself. You say of Alex Bourne, I think this is a very interesting critique from someone who turned his business to testing when the crisis broke. He's a very impressive guy and quite a good analysis, to which you're referring to the analysis that he gives below in the email chain there.
Yes.
Again, this is a neutral question, Mr. Hancock. Would it have been helpful or necessary or protective of others for you to have described your relationship with Mr. Bourne, or do you think that that was unnecessary in this context?
Totally unnecessary, given the context, and it was what mattered was, in this case, seeing whether this analysis that he put forward was reasonable.
Can we just finish up? INQ 000 551 404. Again, this is an exchange. You are the owner of the cell phone. It says, yes, I'm taking not forward this end. That must be a typo. I assume from the response that you get from Alex Bourne that you are signalling here to him that you will be taking his proposal forward. Is that right?
Well, actually, what this shows you is the speed at which all of this was done. You know, this the argument you imply that there should be a full legal disclaimer put on all communications is for the birds. I'm acting at high speed to respond to hundreds of messages. You've picked out a couple. You've chosen the ones that have most tabloid interest, which is, frankly, disappointing, but inevitable, I suppose. And what you can see in all of the communications around this is my impeccable behaviour in terms of taking forward this proposal from somebody who was both a constituent and a somebody trying to help in the national effort. It is a shame that you continue to impugn the integrity of those involved, especially Mr. Bourne, who lent in when the crisis came.
Can I bring you back to my question, please?
I answered it, yeah.
I don't believe you did. The question was, does your message contain a typographical error?
I've no idea. I can't remember sending the message. I will have been sending hundreds at the same time.
Did you take Mr. Bourne's offer forward or not?
I've absolutely no idea. You can see the paperwork if you've read it.
All right. Mr. Hancock, thank you very much. My lady, no more questions for this witness.
Right. Just a few more questions. Mr. Hancock, Ms. Morris.
Thank you, my lady. Mr. Hancock, I ask questions on behalf of the COVID bereaved Families for Justice, as you know. I've got two topics to ask you questions about, please. The first, Joanna Churchill, a junior minister within the DHSC, has recalled in her written statement that there was what she described a tussle between the DHSC and the Cabinet Office at the outset of the pandemic as to who would be responsible for procurement. And specifically, she says in her statement that she said there were occasions where I felt individuals were playing politics and there were lots of big personalities in the room during COBRA meetings rather than a complete focus. And she said, in my view, there was a lack of clarity as to who was in charge between the Secretaries of State in DHSC and the Cabinet Office. There was a lack of understanding of how the NHS worked in practical terms by the majority of those in COBRA. So my question is, did a lack of clarity as to who was in charge between the DHSC and the Cabinet Office delay action to procure PPE between February and March of 2020?
Oh, no. We put out the... I put out the call to get going procuring PPE in January 2020, and that's what we did. There were some areas where procurement was moved, for instance, on ventilators. The Prime Minister did that in order to essentially take some of the huge burden off the department. But I thought there was perfect clarity on that. Some people around a COBRA table may not have understood the distinction between what NHS England does and what the department does, and that would be an entirely reasonable reflection. And in terms of what in practice is done by the Cabinet Office and what in practice is done by the department. Remember, the department was not a big procuring department before the crisis. That was one of the things we had to invent, as I discussed in the previous questions.
So do you accept her observation about being a tussle at the outset?
It's not how I experienced it, but she may have been, she may have seen things that I didn't.
Moving on to later on in March of 2020, at that stage, were you still providing assurances that PPE supply was under control, that you had about 10 weeks' supply left in stock? And if so, on what basis were you making those assurances?
Well, I was given some advice at that time saying that there was, which matches that description. But as you know, I had been working on PPE supply from January 2020. I think the question you're getting at comes from the evidence of Mr. Cummings, but we've already seen that that is not reliable evidence.
Well, the chair has got evidence before her from Module 2 from Mr. Cummings. What my question is really getting at is, did you attempt to downplay PPE shortages in supply in March 2020?
Absolutely not. On the contrary, I was raising the concerns with the appropriate people. So, for instance, one of the things we've discussed is the need to change the Treasury rules in terms of the price at which you could buy. So I raised that at the Cabinet table, and the Chancellor changed the rules. With respect to Mr. Cummings, of course, I had experienced already by then, and it got much worse, some of the very difficult problems that he caused in intervening in some ways in a totally inappropriate manner.
Hancock, and I don't need to trouble you with your view on Mr. Cummings.
No,
it's really about whether you were downplaying anything or creating a comms package, I think is the word we've seen from other emails, about the state of PPE at the end of March 2020.
No. I was answering the question, actually, because in that particular concern, I was concerned to ensure that that particular individual, because of his malign influence, was not heavily engaged in the subject area.
Thank you. Thank you, my lady.
That's very kind. Thank you, Ms Morris. Who's next? Mr Thomas.
Good afternoon, Mr Hancock.
Nice to see you again.
Yeah, likewise. Mr Hancock, you know that I represent FEMHO, the Federation of Ethnic Minority Healthcare Workers. I've only got one topic to discuss with you this afternoon, and I'll be quick. When we've previously met at this inquiry, you've previously acknowledged the existence of and your awareness of institutional racism within the NHS.
Yes.
So here's the question. Reflecting on PPE procurement and the management of the PIP stockpile during the pandemic, in the light of the previous knowledge and acknowledgement of institutional racism, question, can you help the inquiry with this? What key lessons were learned regarding ensuring equitable access to suitable PPE for all healthcare workers, and more specifically, how were the strategies and actions tailored to address the differential needs and challenges faced by ethnic minority healthcare workers? Could you help us with that, please?
Yes, it's an incredibly important question, and I think that it is. It would have been far better if it had been properly addressed before the pandemic, because we did find that the stockpile did not include nearly enough PPE that specifically could be fit tested to essentially non-white features, if you will forgive me for phrasing it that way, and in particular those from a black ethnic group. This was true, for instance, with face masks. I remember going on a visit to a fit test unit and seeing for myself the pure and straightforward physical differences that need to be taken into account. They were not taken into account enough in the stockpile that we inherited, and that must be addressed.
That's very helpful, Mr. Hancock. I want to be forward-looking to assist the inquiry. I know you're not Health Secretary now, but having been in that role, what advice would you say to deal with this in the future?
Well, I think the first thing to do is to recognise that the proportion of people who work in the NHS and in social care who are from ethnic minority backgrounds is much higher than in the population as a whole. The service given in those two professions is incredible from people either who didn't, wherever they were born. The proportion who have ethnic minority backgrounds are much higher, and that was not reflected in the stockpile. So the future PPE stockpile must be appropriate for the workforce that it is primarily intended for.
Thank you, Mr. Hancock. Malika, those are my questions.
Thank you, Mr. Thomas. Mr. Stanton. Stanton's right over there.
Thank you, milady. Good afternoon, Mr. Hancock.
Good afternoon.
I ask questions on behalf of the British Medical Association. I'd like to ask you about PPE supply and demand modelling, please.
Okay.
And to refer you to a document which I hope you'll have some familiarity with, authored by McKinsey and Company, together with DHSC colleagues. It's dated the 29th of March, and the reference is INQ 000 339 131, page 3. And I hope you have that before you.
Yeah.
And on the top line, you'll see it deals with the issue of FFP3 respirator shortages.
Yeah.
Second column makes a couple of observations about how demand will burn down existing stock, and also that forecasted supply would be inconsequential against demand. And then in the final column under actions, it suggests 3 options, or increase acquisition, reduce demand with policy, and approve FFP2 masks as a substitute. And it's the second bullet that I'd like to particularly refer you to, the reduction of demand through policy. I'd like to ask, please, whether you were aware of this proposal to manage the demand for FFP3 masks through policy, and whether you could provide any insight into how this reduction in demand was achieved.
I'm afraid I don't recollect anything in this space. I mean, it is obviously what is written there is obvious, and you have to deal with the art of the possible when you're in a pandemic, as your members will know. But I have no recollection, and I wouldn't really have been involved at this level of detail.
Given what you've said around your priority to save lives, which is entirely accepted by the British Medical Association, would the fact that demand management of this nature was taking place caused you any concerns, or becoming aware of it now cause you concern? Well,
obviously, action 1 is the best, isn't it? I mean, you don't want to have to move people down from FFP3 to FFP2 if you can avoid it. You don't want to constrain demand by reducing the recommendations in terms of usage, for instance, by saying that masks should be used for a longer period than previously. You don't want to do that, but you could. But it may, if acquisition improvement is not possible, then the second and third bullets may be better than running out. But nobody would want to do that.
Thank you. One final question. On a different topic. You explain at paragraph 217 why the UK did not join the EU procurement programme for ventilators. There was some issue with emails having been sent to the wrong email address, but actually ultimately your conclusion was that the UK programme was better and more effective. Can I ask you, though, whether any consideration was given to joining the EU procurement programme for PPE?
Yes.
And why that wasn't done?
Well, I was entirely pragmatic on this question, and we, in the end, didn't join these procurement schemes because they would have, because we thought that we could procure quicker ourselves because of the mutualisation of supplies. And we were, remember, for all the problems, we were in a better position than many of our EU counterparts much of this time. So we made a judgment on that basis. There was the problem with ventilators when the EU sent the invitation to the wrong email address. We also looked, for instance, at joining the procurement with for vaccines with the EU, and I'm very glad that we didn't, because their procurement was slower than ours, and we would have had to give up our supplies into their system in order to be able to access it. So I was entirely pragmatic on this question.
Sorry, could I ask, what do you mean by mutualisation of supplies?
There was part of any agreement was about making sure that the supplies that were bought in were then spread equally across the different participants in the schemes, as opposed to going to who bought them. And we felt that our firepower was stronger than the average EU position would have been.
Thank you.
Thank you, Mr. Hancock. Thank you, my lady.
Thank you, Mr. Stanton. Right, I think we have, is it? No, it's Ms. Parsons.
Thank you, my lady. Good afternoon, Mr. Hancock. I ask questions on behalf of the Covid-19 bereaved families for Justice Cymru. My questions are on just one topic, and that is pandemic stockpiles. I want to ask you about a meeting that you had on the 11th of February 2020, so at the start of the pandemic, with Steve Oldfield, the department's Chief Commercial Officer. It's described in your witness statement at paragraph 60, so that's page 13, the witness statement, INQ 000 536 350. I'll just read it out. It forms the basis of the questions that follow. At the meeting, Steve commented that the devolved administrations had asked to access PHE's stockpiles, which were for England. I commented that the stockpiles should be open to the devolved administrations, but that we should ask them to also plan to stockpile. While not a formal responsibility of the UK government in normal times, I was very concerned to ensure adequate supplies across the whole UK, despite lower stockpiles in the devolved nations. Firstly, is it right, Mr. Hancock, that Wales had its own stockpile and it was the Welsh government that was responsible for that stockpile?
Yes, that was entirely reasonable, given that the NHS is run by the Welsh government in Cardiff.
And we know that there were shortages across all 4 nations of PPE. Are you able to help with why it was necessary for the Welsh government to ask for access to England's stockpiles?
Well, because there's a whole series of different things that add up to PPE as a group description, you know, gloves, masks, gowns. And one country within the UK may have been short of one at one point, and another be able to help. And as the 4 health ministers worked well together, and we helped each other out in this way. So just because the formal delineation of responsibility for the NHS in Wales fell to Cardiff, doesn't mean that if they were short of masks in Wrexham Hospital and we had some spare ones in Chester, we wouldn't send them down the A534. I mean, that's how it's another example of how we work together to try to mitigate the enormous challenges that we faced.
And were you aware of any particular problems faced by the Welsh government in respect of its stockpiles?
Yeah, they were short as well. We all had the same problem.
Thank you. Those are my questions. Thank you, Mr. Hancock.
Thank you very much, Ms. Parsons. Now it's Ms. Mitchell. That way.
I appear as instructed by Amar Anwar and Company on behalf of the Scottish COVID bereaved. I'd like first to ask you about PPE supply. A document, I don't need it to be brought up, but for the purposes of the inquiry, the reference is INQ 000 551 263. This document notes that in relation to PPE supply, that consistent, proactive and clear communication with stakeholders, including devolved administrations, have been vital to the success of the continuity of the supply programme. When reading the documents that have come into the inquiry and have been disclosed to core participants, there have been a number of instances where it's been said, against that background, that because the UK government and devolved governments and different bodies may have all been bidding for PPE, that they may have been cannibalising their own supply in that process. Given that there are a number of bodies that can buy PPE, do you think it would be better to try and streamline the process rather than relying on communication methods between all the buyers?
No, it absolutely would not be better to narrow down who could buy PPE by doing it centrally. It was far better to have many buyers in the global market. I don't accept that there was any cannibalisation. Many hospital trusts went out and bought PPE directly for themselves. It's totally understandable that the Devolved did as well. If you had Jean Freeman sitting here and you told her that she had to buy through the UK system, she would have given you short shrift because she was responsible for the NHS in Scotland and wanted to get PPE. So we collaborated, as described in the answers to the previous questions, but it was absolutely right that everybody went out and bought. Lots of people went out and bought on behalf of the nation. The idea of centralisation, which would require cutting off some options of supply, I think would be a mistake.
Yeah, I perhaps didn't, in my question, mean you to consider that I was saying that there should be one purchaser.
Okay.
Simply asked whether or not streamlining a process would be helpful, and if so, what that might look like.
Oh, well, as per the discussions about in the main evidence session, of course it can be streamlined. Of course you can use better data. Absolutely you should. But that wasn't the reality that we faced at that moment.
Well, this takes me neatly right on to my next question, which is about the issue of data.
Yeah.
I note that when you gave evidence, you explained that all the data at the early stages would be good as much as possible. And you said, and knowing the progress of any particular offer is updated accurately in the system, so someone could just go into it and say, well, this is where we're up to. In relation to independent sourcing, do you think it would make sense in the future to have a centralised system of data? Now, this question I am asking about centralisation. A centralised data system to show if and when different PPE buying bodies, Scotland, the UK government, individual NHS trusts, are pursuing their own sourcing to avoid conflict with other buyers.
Intelligent use of data is at the centre of any high-performing system, increasingly so in the modern world. And so centralising data exchange whilst decentralising activity, including, for instance, procurement activity, is, in principle, usually the best approach. You know, it's certainly the best approach, I think, to fixing the NHS now, decentralised decision-making, but have a national data system. So the proposal you make, I entirely concur with, yes.
Lady, those are my questions.
Thank you very much indeed, Ms Mitchell. May I thank everybody for all the efforts they've made to produce their questioning. It's been extremely effective and I'm very grateful. I'm sure Mr Losty will when we come to him. Mr Hancock, that completes the questions that we have for you. Can I just say this? You're not the first and I'm sure you won't be the last witness to think this inquiry is all about criticising people with the considerable benefit of hindsight and without understanding the pressures that people like you were under. Please, may I assure you that is not my aim. My aim is to investigate what happened, to explore with witnesses matters of public concern and to get people's answers on those areas and to try and come up with recommendations, if I can, that will save lives, something that you were obviously trying to do throughout your time. reduce the human and economic cost of any future pandemic, and maybe reduce the pressure that people like you were under when you had no proper systems in place to respond in an emergency. So please don't take from the questions any kind of predetermined conclusion from me. I am still exploring all different options, and I'm not in the business of criticising with the huge benefits, I say, of hindsight. So thank you for your help. Right, Mr. Losty, who I'm sure will be very grateful to everybody. Losty, I hope you heard that I asked everybody to restrict their questions so we could keep our guarantee to you that you'll make your flight, and they've all been very good at doing that.
I did really appreciate that. Thank you.
Now we've got to hope the airline meets its obligations. Let's go.